we are State of the Heart. My name is Elijah.
My name is Axel.
My name is Kane.
And I'm Eliza.
For many patients with end-stage heart failure, getting a heart transplant is the best way to restore heart function. Ventricular assist devices, or VADs, are devices implanted in the patient's body to assist the heart and prolong a patient's life as they wait for a transplant. State of the Heart is working to solve this complex web of problems by making wireless VADs a possibility.
Our original idea was to develop a cheaper and non-invasive solution for coronary artery disease. This turned out to be illogical. Therefore, we decided to change ideas and work on the newest generation of wireless ventricular assist devices. We will implement variable pitch, which is when the blades rotate around their long axis to change the blade pitch.
One of the poll respondents said that there's a difference between living and surviving.
When they did the echogram, they determined that my aorta valve leakage was at the severe stage, and that if I did not get it repaired, it was going to result in heart failure. And heart failure equals death. But like I had no symptoms, and now they're telling me I need open heart surgery. So that was the hard part.
Current gen ventricular assist devices improves arterial blood flow, but as described in part 1 of our documentary, have serious issues that may happen because it is operated with a driveline wire that connects the insides of the body to the outside world. This vastly increases risk of infection and negatively impacts quality of life.
We found that while ventricular assist devices are effective in prolonging patients' lives, they seriously disrupt patients' quality of life.
The company Second Heart eliminates this problem by creating a wireless ventricular assist device. However, this leads to the problem of an unreliable battery, where State of the Heart comes in by innovating the device Second Heart is currently working on. Our innovation will allow users to do more strenuous tasks and act as a failsafe in case of battery failure.
As you can see here, the wireless VAD is located in an expandable nitinol cage to protect the artery that it's located in. There are spinning blades twirling in this direction. Similar to a fan, it's creating blood flow instead of airflow inside of this artery. This VAD is charged wirelessly to an external battery pack, but there's also a small backup battery inside the stent in case connection to the external battery pack is lost. However, this battery only lasts about 15 minutes and does not leave the patient with much time to get help if a connection is lost.
State of the Heart is currently in development for an innovation of next-gen VADs. We currently have a 3D CAD model and a 3D printed prototype. Our innovation is adding a variable pitch mechanic to the device as described in our documentary part 1. This prototype is just the blade of our device, but it allows you to visualize how we implemented variable pitch in our device, which is through the eccentric hinge, and that allows the blade to tilt angle of attack.
There are two main ways that we could use variable pitch technology to improve this wireless VAD. The first, smaller scale way, involves creating a failsafe using the variable pitch technology. If the patient lost connection to their wireless power or something happened, the variable pitch design would kick in and the blades would lessen their angle, which would create less load on the battery.
Alternatively, if you wanted to do a strenuous activity such as climbing upstairs, then the device will change to a steeper angle of attack, which will increase the blood flow even more.
During P3, I've created many testing environments for our product. This is done online using Autodesk CFD or Computational Fluid Dynamics 2020. The reason I'm doing this online instead of physical is because of physics limitations and budget. Most of our products are using 3D printed products, and that created many physics limitations for accuracy, especially because we were using 10 times scale.
And get excited for part 3 of our documentary, where we're going to show our testing results, and stay tuned for part 3. Get excited. I'll see you there.